Hi, everybody. I am Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. This particular patient has all three of those conditions. She has acne, she has hyperpigmentation, and she has some scars. And we worked on all those to be able to improve her skin quality. You could see over the course of close to 6 months or so, we were able to really significantly improve her pigmentation. We were also able to help with her acne and then even improve some of her scars too. And we do that under a few different steps over here. So I'll walk you through just exactly how we did it. It looks like actually the first session was in November 2023 and then in March 2024, where you can see like this full course where we did the Cure laser as well as Pico lasers to help with the patient's acne, with her oil production, and then we also did that to control actually her pigmentation, because her pigmentation was related to acne. Sometimes people get lesions, cystic lesions, it's a little red over there, and then essentially with a little bit of sun exposure, it gets stained dark. So what we want to do is we want to control that acne, control that oil production, so that way you no longer have this hyperpigmentation and that scarring. Thank you so much, Mrs. Jones. Good seeing you on. Appreciate you as always. Mrs. Jones is saying this is a beautiful result, which I really, really appreciate you saying, and continue to be supportive. This is a patient who is of Fitzpatrick 6, melanated skin. She was concerned about her pigmentation, felt that it was something that was very obvious on her skin, and we had to get it so that things were more evenly matched. The way to do that really was with a few different steps with the Cure laser to normalize oil production. We did that in 3 sessions. So over the course of 3 months, we did it once a month for 3 months. And we also did the Pico laser. So Pico laser works very, very well for pigmentation. And it also even improves scarring if you do it a certain way too. So we improved some of her scars as well too. And just overall, the skin quality just got much better. How to get rid of PIE on dark skin. Ness is asking how to get rid of post-inflammatory erythema on dark skin. That actually is very complex. Typically, you want to start with topical creams like azelaic acid or something over the counter. You do 10% azelaic acid. That works out pretty nicely. But you may have to escalate it with a laser. It's just that there's very few people that do lasers in darker skin types. Most of our patients are darker skin type. I'm very, very comfortable with it. So it depends on where you're going to go. But there are ways of doing laser. I use XLV, even in Fitzpatrick 6 patients, very, very carefully, very sparingly. If we need to do it, though, we will do it to help reduce the redness there. And, it's from my standpoint, it's like a lot of people think that these type of procedures can only be done in certain skin types, and they just say that other skin types just have to live with it, or they have to do like useless treatments like microneedling, which is really useless for this kind of pigmentation. Really, unfortunately, it's very, very useless, and it's unfortunate that people still try to push it for hyperpigmentation. It's not great for pigmentation. It's not really great for scars, and sometimes it can make pigmentation worse. There's a lot of different patients who have gone microneedling, and they'll say that their hyperpigmentation actually got worse after their microneedling sessions. Ness is saying that they're from Netherlands, as though it's a bit farther away. Appreciate you tapping in at this time from the Netherlands. Where in the Netherlands are you at? In Amsterdam, which I love. Really beautiful city, actually. I love it, actually. Van Gogh Museum is one of the favorite museums in the world. It's really, really cool. Let's see here. And then just the canals. Everything's so pretty. Masood is on. Hi, how's it going, Masood? Thanks for coming on the other day. Actually, I appreciate you so much, Masood, because it turned out one of my patients the other day, he said that he reached out to you when he came on over here, and then you were talking about just your experience with me. So I really, really appreciated that. So thank you so, so much, Masood. I know you've been really happy, and we only have just the result after the first session, and it's even better now after a second session. So I really, really appreciate you coming on. Ness is from Rotterdam, which he says is better than Amsterdam. I've never been to Rotterdam. I'll have to one day take a look and see. But this is, this is the Cure laser. This is with the Pico laser. this was really a way to solve this patient's solving her acne, helped with her pigmentation because she no longer gets the flare-ups that cause the pigmentation. And then we also did the Pico laser to help, of course, pick up that pigmentation too. So it works incredibly well. You could do lasers in darker skin types, and it's not true that you just have to live with it. It's not true that you have to suffer from these kind of conditions. There's a lot of options. It doesn't have to be like this cookie cutter type of thing really ever. It's just like there's a lot of different things that we could do for pigmentation. I'll show you actually somebody else's pigmentation. This is actually a gentleman. I'm going to show you this patient's too. It's actually really cool too. I don't show enough guys with their pigmentation. Actually, I wanted to show you this one. Let me see if I can pull this up there. Because sometimes it's like a lot of people don't realize, a lot of people don't realize that everybody of all genders, all skin types, they have these concerns, they have these conditions, and like it's nice to see like there's ways to solving this. And look at this gentleman, worked outside all his time for a long time, and was really concerned about the fact that he just had different skin tones. So this is something over the course of 6 months we got pretty close to his natural skin tone over here, and we cleared up his post-inflammatory hyperpigmentation as well as his melasma, and it suppressed the melasma, cleared it up really nice, and you can see, look at that incredible improvement over here. Let's see here. Watermelon saying, please open a clinic in Dubai. What about Abu Dhabi? I don't know. What's the difference between like the Dubai area and Abu Dhabi? Some patients were saying on here, or some people on here were saying to go to Abu Dhabi. Some people are saying to go to Dubai. So what's the thing over there? Doc, where are we located? We're in Newport Beach. We're just a few minutes away from the airport. We're over in Newport Beach over here. So take a look. You can see this is hyperpigmentation. This is where I started. A lot of what I did was with pigmentation. I wanted to focus a lot on pigmentation because I wanted to treat all skin types and clear up any pigmentation issues really nicely and rapidly for patients. And you can see significant improvement over here with this patient's hyperpigmentation. Again, something that I do a ton of. And you can see just over and over and over again that there's ways of doing this, even in patients who were turned away, people said, hey, there's nothing you could do with this pigmentation. Just got to live with it. There's in your skin type, or here's just some hydroquinone. And it's like really difficult because it's like, it just affects people's self-confidence in such a way that, my patient today, she was saying, actually, it was interesting. It was her body scars that she felt it was just so distressing for her, and she just felt that she had done liposuction, and there's so many irregularities that it was affecting her work. She was saying, and she was hardly able to do work effectively. So it's interesting how it affects people in so many different ways, and there's not really a lot of data about that. There's not a lot of people that will just go in and see how this is affecting people and really making people suffer. This is another patient. This is a patient of Indian descent. You could take a look and see with her melasma what we did. Cleared it up really nicely. She's somebody I've been working on for, she comes in once or twice a year. I've been cleaning it up a little bit more now. Actually, we should probably get a new updated photo for her. It's really, really nice, really incredible improvement. And I think sometimes I see her name come up on here. So I don't know if you're on tonight, but if you are, just say hi, because I know that you're super happy with your skin, and it's like a huge confidence boost for you too. But Sue is saying, thank you very much. I am extremely happy with everything. See you on the 23rd, God willing. Oh, awesome. You're coming this soon, actually. I didn't realize you're coming this soon. We'll get a new updated photo then. Eric Callahan is saying, about hyperpigmentation, some dermatologists want to prep before and after TCA with retinol and hydroquinone to stop melanin production. Do you have your patients take a tyrosine melanin inhibitor? Yes, I do. I typically don't do much with hydroquinone though, because I do think that there's more risk with hydroquinone with getting loss of pigmentation. So I don't recommend that actually, typically for my patients. So a lot of times I will do things with non-hydroquinone based. So I use a cream that is non-hydroquinone based. Hi, Dr. Qazi. What was the treatment plan in both cases for the pigmentation? So this was with mostly with the Pico laser. We do use creams to suppress the pigmentation. So we do all those to make sure that it's really safe for patients as we do it. We don't want rebound pigmentation afterwards. And guys, for some weird reason, again, they decided to just basically shadow ban me. I don't know what I did yesterday on the live, but something I did, and now they are shadow banning me today. So if you could just like my page, that'd be really helpful. like it and share it. Actually, that'll be really helpful too. Follow it. Hypopigmentation cannot be treated, but hyperpigmentation can be treated or at least get better with time. Eric is asking, hypopigmentation can still be treated. It's just something you definitely want to avoid because it could take a lot longer to improve. Hyperpigmentation a little bit faster. So just something to pay attention to is that we want to avoid hypopigmentation. Like really, we want to avoid that a lot. Tiffy's asking, hi, I have a dermatologist appointment tomorrow. What prescription should I ask for to help with a scar? Usually it's not a prescription that's going to really solve scars. Usually there's more involved. I do a lot with scars. There's a lot of work that's involved with like manual type of work. If it's rolling scars and it's stuck and it's tethered, we may have to do things like with subcision. We may have to do things where we have to actually do volume replacement like TCA and like Bellafill or Sculptra. And for the deeper scars, we might have to do TCA CROSS. This is another patient of Indian descent over here. You could take a look at him. You can see we got a really even skin tone over here. Again, actually, I see him regularly, and he's actually even better now. And his skin quality is just significantly better. It's just so much better. His skin feels more firm. It's just like a better quality skin. So I'm just showing you guys a few different things here, a few different patients that for pigmentation. We treat pigmentation a lot because, again, most of our patients are darker skin type. I want to make sure that patients are going to be really safe. So that's how we could do this really clearly, over and over again. Take a look at this. This is a really beautiful result. And, someone like this patient, he saw my page, realized that he had hyperpigmentation, but other people may not even realize that there's different skin tones. One way you can look at it and see what like your skin tone is right above your brow. A lot of times that's your natural skin tone right above your eyebrow, and see if it's matching your forehead. Is it matching your cheeks? You may notice that there is a lighter pigmentation there, and that is what we're trying to get closer to, that real natural skin tone. I'm not trying to have you lose your pigmentation, not trying to go lighter than your natural pigmentation, not interested in it at all. I think skin tones are really beautiful. Everyone's skin tone is beautiful, and everyone has a little bit of melanin, and it's totally fine if it's more than some people with more shades. But what we're trying to do is get close to your real natural skin tone, the way it should have been when you were born. That's what I'm trying to achieve, closer to remove that damage that occurred years and years. Sometimes it's like when you're 4 or 5 years old and you didn't have a sunblock on your face. You went out and went to play in your backyard. You weren't wearing sunblock, and it stained it for decades now. So there's ways of improving this though. Now they're saying that people say that sun damage is always deep inside the skin at dermis layer, and it is hard to remove with lasers and skin of color. Please share your thoughts. It is harder to remove. This was not an easy way to do this. I had to go very slow, very steady to actually improve this pigmentation. It's not easy to improve pigmentation. It's a slow process. It's something that takes several months to be able to get to this kind of improvement, because otherwise you could lose pigmentation or you get excess rebound pigmentation. So you got to go very slow. Lucky Singh is saying, it's beautiful to see you help so many people with darker skin tones. Maybe doctors say it's impossible to do. Clearly, you make it possible. Thank you so much. Oh, I see this other question by you, Lucky Singh, saying, hello, Dr. Qazi. Some report an orange peel texture after Pico laser. I had that and it never went away. What are your thoughts on the orange peel texture risk? That could occur with essentially with overheating or just a lot of exfoliation of the skin. Sometimes it's due to the products that patients are using afterwards. People may put people on certain products that are excessively exfoliating, and when they do the lasers or any devices, it may be really stripping your layer and now allowing your skin to heal, and you just continue to have a lot of damage because you're not producing enough oil to overcompensate for the dryness of your skin. And that's how you got more of that orange peel. But usually things like that potentially can end up helping, like a mild exfoliant like azelaic acid, and you combine that with a moisturizer. Sounds counterintuitive, but a chemical exfoliant with a moisturizer like Vanity Cream actually works very well. Just 10-15% azelaic acid can actually help out quite well actually with that. But it just takes a while to fix that. Reese's Buttercups, how are you doing? Reese's Buttercups saying, hi, Dr. Qazi. I am just healing. Cannot wait to continue the healing skin journey with your help. It's awesome, Reese's Buttercups. She knows that I love her name, and apparently it does love Reese's. Just like I was saying that when I was in med school, I used to just always eat like all these Skittles and like just candy when I was running around between rounds, just like popping a bunch of that. In between, like patients were just like, let's go put a bunch of Skittles in there, and that was my energy. So it's like it was amusing to see that somebody else loved Reese's as much as I did. Eric Callan is saying, would it be okay to not do a melanin inhibitor before and after TCA CROSS if you're on the lower Fitzpatrick scale, or is it possible hyperpigmentation can be permanent? It's possible that you still have more melanin than you may expect, and your practitioner saw that you have melanin, and that's why they want to suppress it. So it's best to do the melanin suppression, but maybe it's not going to be a permanent reaction if you have the hyperpigmentation, but it's certainly something you should try to avoid. Definitely try to avoid it. Would you say patients with sufficient zinc, copper, and vitamin C intake have better results for prognosis? I think zinc does play a role in the wound healing portion of things, but whether or not it's a better prognosis, tough to say, but it's probably a bit faster recovery process. So, in that regard, I think it's really nice, but I wouldn't necessarily say that it's a better overall prognosis per se. Actually, I want to show you this. Actually, it's another cool one. Let's see this one. This is a really good one too. My theme today is just going to be darker skin types here and doing pigmentation. So you can see this patient, I've been treating her for a long, long time, probably almost 8 years now, I think. She's one of my patients that I had from the very beginning, my first year, and it really just was like, she's just like, I want to solve my skin. I look at myself and it's not what I look like normally. I just don't know what happened. There was just a lot of damage. I just want this a lot more evened out. And she's someone who cared a lot about skincare, was like really in the skincare world, and was just really disturbed by the fact that just she had a lot of different pigmentation on her skin, and wanted to just be more even. And we got there. Again, her skin type, something that's really challenging for a lot of people, but we got closer to her natural skin tone over here. That is actually closer to her natural skin tone there. And it's pretty cool. It's a pretty cool effect, and also improved her scarring, improved her overall texture. It's not an easy process at all. It's like this took a lot of work, a lot of effort, and the patient did a great job of just being like really good with sun exposure, really good with that. Thank you so much. Who is Young Guapo is always really kind. He always comes on and says yes, King, when he likes the results. So I appreciate you. Let's see, Eric Callan saying, I saw her on YouTube videos. She looks amazing. She does look amazing. She's a really, really kind woman too. Really, really kind, and looks awesome. So just showing you just different process, in terms of pigmentation. I kind of focus a lot on scars, but I do a ton of pigmentation. I do a lot with pigmentation. So I could do scars really safely and do it really, really well. And a lot of times, like for example, that patient I just showed you, her pigmentation was due to her scars. Her hyperpigmentation was due to her acne. So solving all that worked out really well. Adil is saying, can I do lasers while on Accutane? Yes, you could. It depends on the dose though, but you could do it. Especially when you do it with me, I tend to do more like a micro dosing way of doing it, but yes, you could do it. I have a thing where I put my pinky up when I drink water, actually. I don't know where I picked that up from. What are your favorite products for combo skin with congestion? So keep it really simple. First of all, let's take a look and see what you're using on your skincare regimen. It should be really basic. You don't have to overwash your face. Just wash it one time at nighttime, and do a strong sunblock. Do a really strong sunblock where like SPF 50 is really, really, really helpful for you, so it doesn't get hyperpigmentation like this. Typically more like for acne-prone skin, physical sunblocks could work out really well. And then use a tretinoin at nighttime. So tretinoin meaning like some sort of retinoid. You get a prescription for tretinoin 0.025 is a great starting point, or you could do different, which is over the counter. That could work out as well. And then also just moisturizing. So moisturizing means like Vanity Cream. Vanity Cream's super cheap, but it works awesomely well. It's really great cream. And I think it's underutilized. People just are so obsessed with like all the other brands, and they think that it's something that they could get from like Walgreens or Target. It must not be good. And it's funny because every once in a while, like I'm scrolling through like TikTok or anything else on there, and it'll be like someone saying that these drugstore brands are just garbage, and it's like, not great. And it's actually kind of funny because they're great, actually. Like Vanity Cream's awesome, CeraVe, Cetaphil, excellent. And like, why would you not use what's like just like, super accessible and affordable? No matter where you are in the world, you can just pick it up. I was in Spain and I didn't have like skincare stuff, but like they had like, Vanity Cream. So it's like sitting there and it's like, okay, awesome. I was like, I know that that's going to be safe for my skin. I'm not going to experiment on something else, and it's going to be totally fine. So BCN is saying, yes, I don't like Sephora skincare. It's so funny because just like so many stuff is just unnecessary. It's just so unnecessary. I do think that there's a role to play for like other skincare products. If you want to like kind of now optimize it, it's already looking great. You're like, hey, can I get even better skin? Sure. Like now let's add a few other things and take a look and see like pigmentation wise, what else we need to do. But start with like the real basics and you'll see that like it's actually pretty transformative just from that. Resin is on. Good seeing you on today, by the way. Good seeing you with the follow-up today. Skin's looking awesome as we were talking about. And Resin is saying that she loves Vanny cream. Let's hear. Nad is saying, apart from Pico lasers, do you also use peels for treatment of sun damage? Yes, sometimes I do, especially when there's more melasma. I definitely would like that. Dr. Karobi is saying, hello, doctor. What to do for spots that are hyperpigmented post-CO2 laser 15 days after? What lasers do you have for pigmentation? Do you have a Q switch? Do you have a Pico? Do you just have a 1064? What do you have? Or like, what creams are accessible? I'm not sure what country you're in, if like hydroquinone's banned in your country or not, or if it's like, not accessible enough. But I mean, starting with like some sort of tyrosine kinase inhibitor, you could just do hydroquinone. We do like a compound form of like triluma too, which could help out. And then seeing if maybe like a Q switch laser, if that's what you have over there, or a Pico laser, that could potentially rescue it. 15 days is really not going to be much of a problem. It's going to clear up probably 4 to 6 weeks after if you just do some hydroquinone afterwards. And typically you want to do like some sort of exfoliant. So you could do like tretinoin as well, like 0.025 tretinoin, and that could potentially help you out with it. Hi, I guess it's Ofo. Ofo, how are you doing? Keep it Zen. Good seeing you on, by the way. Keep it Zen's on here saying, oh, I love this girl. I've watched her speak about her experience. Amazing results. She is gorgeous. She is gorgeous. Thank you so much, Keep it Zen. She's a very, very kind lady. Very, very kind. As like, as you are and so many of our patients are, really, it's an amazing, super rewarding world, actually. It's super rewarding. A lot of people actually, interestingly enough, because it's like med school time and like people are trying to get in, like are stressed about med school and then like residency, things like that. People always reach out to me and like in that point and like, is it still worth it to go to medicine? It's like 100% worth it in my mind. I think it's awesome. I think it's a great field and there's so many different things you could do, within medicine. So I think it's really cool. I know that the business of medicine, like the corporate structure of it's not great, but there's still a lot of cool things you could do and like lives you could change. And it's really like almost nothing else like that. Let's see here. Semicolon, which is one of my favorite things grammatically, semicolons, is saying, and I got such oily skin, I don't know how to control it. Oil production really, there's a few things that are happening with that. Sometimes it's due to hormones that are basically, when your hormones are fluctuating, your sebaceous gland can get really hyperactive and it pumps out too much oil. Other possibility is that essentially you really have irritation on your skin. So let's say you're overly exfoliating your skin and now your body's trying to overcompensate and produce a little bit more oil production because of that. So I'm not sure what your situation is, but you want to do things to suppress that oil production. Easy thing to do is topically, you could do retinoids that could help out with oil production. But if you want more of a long-term solution, or if it's like a lot of oil production, then you could do something like isotretinoin, Accutane, or you do the Cure laser. That's what I was showing earlier. The first result that I was showcasing, where did it go? This was with the Cure laser. This was with normalizing the patient's acne, her oil glands, and then also helping with her pigmentation. And then I was showcasing over here, this is with the Pico laser. It actually does help a bit also with some of the oil production as well. Justin, I guess to say, is saying, I just developed stomach stretch marks. Is bio oil and tretinoin good to use on them? I wouldn't know necessarily about bio oil because I do think it may be reactive. Tretinoin is also really excessively irritating for the skin, for the body. I would say not really recommended for the body. There's not really great options for stretch marks, unfortunately, other than lasers like erbium laser could work well. You may have to remove the skin. If it's hyperpigmented, that may be a little bit easier. If it is like just a pigmentation issue, then something over the counter you could do is Eucerin's anti-pigment cream. Works really well. So it's a slow process, but for the body, I think that's really, really great because it doesn't overly dry the skin, not particularly irritating. So maybe consider that. Let's see here. Jabron is saying, hello, doctor. Could microneedling with dermapen work for hypertrophic scars? Is your name Jabron because of Khalil Gibran? I always love that author. He's a really good author. But microneedling with dermapen, does it work for hypertrophic scars? No, it actually could make it worse. I would not recommend that. Eric is saying, can retinols or peels get rid of flat moles or sunspots on skin permanently? Or will they come back if you go in the sun and the only way is laser? If peels do, you use light TCA or Gessner. You could use peels. It's you're absolutely correct. A TCA Gessner peel is totally okay to do for sunspots, and it's possible. Flat moles, different process, unlikely to be really significantly removed because there's probably some depth to it. You always want to get your moles checked out, double check that, go to a dermatologist, double check your moles. You don't want to just remove that. It's easy to remove. I mean, we can always remove those, but you don't do that unless you're really sure that it's totally safe. No, pretty girl, it's not pre-recorded. I'm definitely here. She said, pretty girl saying, by the way, I'm not just saying this, I'm pretty. Her name is actually pretty baby girl, I should say. Her name is Pretty Baby Girl. It's not pre-recorded. This is me. I will never pre-record these things. Sometimes I just couldn't be on it, and I just say that I'm not able to come on. So no. And actually, I was just playing around and showcasing because someone was asking for this particular patient again, and this is with the Pico laser. This was also we did a Cure laser also to help with her acne, and we've been working on her actually just throughout the last few years, doing little tweaks. She does a little bit of Dysport too. And it's been really useful for her skin quality. Resin, yeah. So people do sometimes think that I'm not real because it's like you don't know nowadays. It's like tough to tell. I guess it's like everything does look like it could be fake. You change your eye color too. No, actually there is a doctor out there that does change eye colors. I don't know if it's safe though. It really doesn't seem too safe to me. But I saw like some guy on there that he tries to lighten up people's eyes. Pretty baby girl saying, okay, you also are live on the other app because you're reading someone's comments. Yeah, so I go on a few different platforms there at the same time, and I wish one day they could all like communicate and be friends, and like we could all like have this a joint chat. That'll be like my dream one day. Hopefully we could do that. That'll be really useful. So anybody is like wants to build their own platform, please build that for us because that'll be really cool. Is hypertrophic scarring hard to treat? Not necessarily. No, it's if it's just hypertrophic scarring, no. If it's keloids, that could take a lot longer. But hypertrophic scarring, we could work on that with either steroid injections or laser. And a laser, you can even go ablative and like smooth it down a bit more. So not necessarily. But yeah, this is Mrs. Jones is saying that she loves these results, and this patient loves it too. She's so happy. She was telling me, she told me that this really affected her confidence. It really made her suffer. It was really difficult to have this kind of hyperpigmentation, this melasma that she had, and it's like came out one day. Everything's going well in life, and then one day it's just hyperpigmentation. How does microneedling make scars worse? It could sometimes make the scars wider. So if it's more of a boxcar scar, sometimes they actually can make it wider. And sometimes if it's an ice pick scar too, it could become an ice pick scar and become a boxcar scar. So it could become worse because of that. So the other thing is it could cause hyperpigmentation. So that's the other problem with it. Actually, I've almost 2 times a week, I'll hear a patient say that microneedling made their scars worse. So that's not good. That's what I'm hearing. Multiple times you hear that. How is a Cure laser effective for acne? What it does is it normalizes the oil gland. So the sebaceous gland is hyperactive, and it'll sometimes get triggered by, let's say you go on a dairy binge. You're like, hey, I really love milk, and I've tired of the fact that I can't have milk, and I'm just going to go and drink a bunch of cow milk this week. And then you do it, and then you end up getting some acne because your sebaceous gland now got hyperactive and it starts pumping out a lot of oil. Now with the Cure laser, it doesn't react as much like that. So it doesn't typically just respond the way it normally would have responded. It still gets a little bit oily because it's only 70 to 80% reduction, which is still really amazing. But if you're going on a binge and your hormones keep fluctuating, it's it's reduced, but it's not gone completely. We don't want to shut it down completely because you need oil as you get older. You always need some oil as you get older. So it's just also still be careful with your diet. Still be careful with making sure that you're otherwise exercising, because actually excess weight, or fat cells, can cause you to be more oily as well. There's an increased estrogen with fat cells, and you gotta be careful with that because then they could end up feeling a little bit more oil production too. So just pay attention to that too, making sure that you're really healthy otherwise. Can you tell me more about Vampire Facial PRP Microneedling? Will you recommend it? I think at the right place for the right purpose, it's fine. If it's just like a right rejuvenation for your skin, it's totally fine for that. But I don't love it when people are pushing it for scars or pushing it for melasma. I mean, people are doing that. They're recommending that. Yeah, and someone's talking about how people are talking about or drinking raw milk now, which is it's ridiculous. It's wild. Let's see here. I am from Europe. I booked an appointment for end of July. What's the furthest country that patient came to see you? SB, good seeing you on. I believe, are you from Germany? Is that you? Let's see here. The furthest is probably New Zealand, but maybe Thailand. It's maybe one of the furthest ones too. Thailand. I've had a couple patients actually from Thailand, and maybe that's the furthest, I think. India, actually, maybe that was a little bit. Actually, that was another. He came straight from India, flew in, and like left the next day. I was really surprised by that. Did like a long journey and then left the next day, and doing amazing, by the way. He was actually an interesting patient now that I think about it. And he's somebody who is a physician in India, and he suddenly got chickenpox because there's a chickenpox outbreak in his hospital. He's a physician, and he acquired chickenpox in December. He never had it in his life, and he had terrible scars from that. So I worked on it, and it's so smooth now. It's so good actually for him. But he came all the way from India, so that's another place. But I do appreciate everybody that comes from anywhere, and even if you're right next door to me, I'm going to take care of you to make sure we can get this solved, because it is such a problem for a lot of people, and there's a lot that we need to do just to help out this world, so that there's less stress and less of this anxiety. There's a lot of anxiety out there. I just don't want this to be another reason why people would be anxious anymore. Let's see here. Ganesh is asking, Doctor, will pigmentation caused by COT be permanent, or can it be cured? It could be cured. It could be helped out a lot. It does not have to be permanent. Reese's Buttercup is saying, not sure if it was asked, but can TCA be used in the same scar if it's stubborn? Yes, it could. Yes, it could be used there. I think I got to double check to see what scar you're referring to, though, Reese's. Let's see. Keep It Sen saying, I was so happy to find out you were in California. Thank you so much, Keep It Sen, and good seeing you on. Hopefully your recovery processes have been good. You just did the phenol peel last week, and I know that you were saying that you're feeling good about it, and it's your skin's feeling good already. So I really appreciate you. What treatments can be done for hypopigmentation? That's a long discussion, but it involves a few things that are sort of easier to start with. Is something, first of all, to see what is the reason why you have hypopigmentation. I'm going to kind of just assume, though, for this purpose of this conversation, that it's more due to like a particular cause, maybe potentially like a laser. So I'll just focus more on laser-induced hypopigmentation, which actually a lot of times is reversible if you tackle it in an early, timely manner. And as long as the practitioner didn't go excessively deep with the laser. But there are ways of triggering it. You can do tacrolimus, which could potentially help stimulate melanocytes, and you combine that with UV light, just basically do that once a day. And then you could do something called the excimer laser as well. And an excimer laser could work for other forms of hypopigmentation, especially more like autoimmune conditions. It could be an excellent option like psoriasis, as well as something that also excimer lasers have been used for. But hypopigmentation is something that I could help, like vitiligo patients. They could benefit from excimer laser. So I'm not sure particularly what kind of hypopigmentation you have, but that's all options there. Sophia is saying, I just had my consultation today. It was so nice to meet you. Your team was so helpful. I can't wait to start my treatment. Thank you so much, Sophia. And I believe you're calling all the way from New York, right? But thank you so much. We'll look forward to seeing you really soon too. Eric is saying it would stay. Okay, let's see here. Eric had a few questions here. So this will be kind of the wrapping up for my night tonight. But Eric is saying, I had a blackhead that stayed in the pore too long and it dilated and enlarged. It's now more of a deep hole instead of a flush with the rest of the nose. I had other pores that lost the plug in it, filled back up, but this one is not filling back up, and oil still comes out when I squeeze it. I can't do TCA CROSS because the bottom is a sebaceous gland, or can we just close the walls inward? It would still stay deep but narrow. Does your clinic do something like that can raise the bottom of a deep pore? to answer your question, so Eric has a deep pore, and he's asking, can we improve that with something like TCA CROSS? Yes, we can improve that with TCA CROSS. And in fact, there's somebody that I've been just working on. Her skin looks amazing. Been working on her just since January, but I do TCA CROSS every 2 weeks in her case, and it's an awesome result already, an incredible improvement already. And we just did a laser last week. It's going to be even better. So what would be a really good drugstore skincare product for hyperpigmentation? Eucerin's anti-pigment cream. It's really, really good. I just wish that they didn't patent it. They patented it. And I think it should be more accessible to more, so that we could play around with it and mix it with a few other things. I think it'd be awesome, but they patented it. And that's the way the world works. All right, guys.